Hello, and welcome to Mentor Training for Southeastern Community College's Focused Client Care Experience for the Associate Degree and Practical Nursing programs. We are excited and thrilled that you have agreed to be a mentor for our nursing students to help them complete their last phase of nursing school. It takes very special nurses to train our new ones, so Southeastern is grateful. So what are the differences between a mentor and a preceptor? There are some big differences between the two. So preceptors are generally assigned to a nurse or a person for 3 to 6 weeks in order to learn the facility, the policies, and the procedures of that place. A mentor, on the other hand, can be someone that you look up to for a lifetime. So we usually assign mentors to students to guide and coach them. This is someone that our student is going to look up to as a professional nurse. The North Carolina Board of Nursing has changed the language for what we have previously called mentorship to guided clinical experience. And you may find that we refer to you as a coach. So what does it take to become a mentor? It's really important to know yourself inside and out and to see yourself as others see you. It's important to recognize your own strengths and weaknesses and use that to your advantage to help teach the students. One thing that we have to really talk about are biases and prejudices. We all have them. Everyone has some sort of prejudice or bias against something that can influence our feelings, our decisions, and our behaviors, and sometimes that can happen in surprising ways. Recognizing and overcoming these can be challenging, but it's a very important process whenever we're trying to be tolerant and open-minded, which is pretty much what we have to do as nurses in our careers. So we are never going to totally eliminate these from medical interactions, but as healthcare professionals and caregivers, we have to develop a greater degree of self-awareness to the presence of those biases and prejudices within us so we can understand how that affects or can affect the quality of care that we provide to our patients. So just to throw out some examples, so the quote-unquote frequent flyer who comes in, or the person who has drug-seeking behaviors, we all might feel some type of way about that, but it's important to recognize that within yourself. Our students are very astute to these type things, and the way you react in situations as a mentor can color their experience as a student. So begin with the end in mind when it comes to mentorship. Stephen Covey talks about 7 habits of highly effective people. And one of these is beginning with the end in mind. So how do you want to be remembered as a mentor? At the end of this focused client care experience with your student, what is your goal? And how do you want that student to remember you? First things first, life is hard, yard by yard, but inch by inch, it's a cinch. So keep in mind that these people are still students. They are not licensed nurses. They are working towards that goal, and you are going to play a tremendous role in helping them reach this life goal for themselves. They're going to learn as much from you as they have in 2 years of nursing school because it's a different type of learning. It's real life. They're going to learn things about how rubber meets the road in the clinical setting. They're going to learn to prioritize for 5 to 6 patients. They're going to learn skills are far more important than just starting an IV. They're going to learn habits and attitudes and how those affect the real world of nursing. So teach them well. I promise that they are going to remember this experience for a lifetime. Think of this as a win-win. Really, we should try to think about life in that way. The mentoring program for Southeastern Community College is a win-win situation for us. We have the opportunity to place these students in your facility to meet a State Board of Nursing requirement that is required for these students. You are providing us with a portal to meet that objective, so we win. You have the opportunity to get to know the student and to help mold them into great nurses like yourself. That gives you and your coworkers an opportunity to experience how well the student may work out as a fellow coworker. So that's a win for you. It could even help the facility decide if this student would be a good fit for your unit. So we all win. The next thing that Stephen Covey talks about is seeking first to understand and then to be understood. Some of the most influential people that I have encountered were good listeners. In groups, they sit back and they listen and they don't have to say a lot. They take all of the information in so that when they speak with knowledge and wisdom. There are usually several sides to anything, but when you fully listen and you get all the facts together, you are more apt to be able to formulate an educated opinion about the subject matter. So by listening first, we allow the other party to talk without competing for the opportunity to express thoughts and feelings that are our own. And it's important to remember this whenever we are teaching or mentoring people, because sometimes they have some knowledge that you may not know they have, and they're seeing situation from a different standpoint. So sometimes asking them, explain to me how you make that connection, or seeking first to understand their thought process and then helping them to correct that thought process should they be wrong. And then sharpening the saw. Sometimes you may need to reflect that you are or are not doing nursing care according to the principles that you were taught in nursing school. There are 100 different ways to get to the same destination in most places, but we have to be sure that the ways that we are getting to the end goal are safe and with good principle. And that's a big thing for Southeastern Community College, is that we turn out nurses who have good principles and they are providing safe care. So whenever you are helping them do skills at the bedside, assess patients, learn to prioritize, all of these things that we do in nursing in the real world, please make sure that you are teaching them with safety and good principles in mind. And then in terms of the habit of renewal, how do you rest and relax and unwind from a difficult shift? Because these students will encounter that with you. And this is the first time that they probably will have worked a 12-hour shift, at least from a nursing standpoint. So take time to sharpen the saw for yourself, but also teach the student how to care for themselves during this experience. Because being able to fill our own cup so that we can fill the cup of others is extremely important. Turn stumbling blocks into stepping stones for these students. The difference between stumbling blocks and stepping stones is how you use them. So use moments to teach. We call these teaching moments whenever we're in clinical. There are times when students do things that will make your hair stand up on ends, but we have to remember that we're there to teach them right away. We don't always spend time writing up unsatisfactories whenever we can use that moment to teach the student their error and the correct way to do things. So remembering that they are new to all of this is important. And how we correct that is also important as well. So should you notice that your student is doing something that is wrong, that is unsafe, correct them in the moment. Don't wait for the end of the shift. Don't embarrass them in front of the patient or in front of your coworkers, but pulling them to the side in that time frame and saying, hey, let's talk about how you did this. So using stumbling blocks as stepping stones to help them become better nurses. Sometimes where we came from says a lot about who we are. So like yourself in school, many of our students have crossed a lot of hurdles to get to where they are going into this mentorship. Some of them have overcome family illnesses. Some of them may have had children while they were in nursing school. Some of them may not have made it through the first time, and this is a second time around. So try to get to know your student and where they came from. It will help build a good mentor-student relationship. One thing that we want to teach our students, particularly in the focused client care experience, is the ability to critically think at the bedside. And there are many factors that can affect this ability. We all have to function despite our dislikes and our prejudices and biases, like I talked about earlier. So knowing what those are and being self-aware of those is very important to becoming a professional nurse. Helping your student understand that is important. Self-confidence can also be an important factor. We spend a lot of valuable time thinking about the consequences of failure. So helping your student to overcome that will help them be successful. Effective communication and interpersonal skills are key. You have to be able to understand and to be understood by other people. If people feel like we are judging them, it sets up an adversary relationship from the start and can hinder that learning process. So critical thinking is based on many of these things. So, knowledge enhances one's ability and vice versa. Situational factors also can reduce the ability to think, particularly for students who do not have experience. They are often more anxious. They are often more stressed out. They have often not ever worked a 12-hour shift before, so fatigue can also play a part, along with these other items that are listed here. And then, like I said, people who think they are being evaluated or judged tend to spend a lot of time worrying about that, which drives up their anxiety and stress. There are lots of situations, or probably all the situations you will experience in the clinical setting with your student. You are going to have more knowledge than they do about that particular situation. So helping to teach them successfully and using those moments as teaching opportunities will really help them to reach the goal of becoming a great nurse. Our students may also be exposed to distractors, and one example of that could be cell phones. Students are not supposed to be using cell phones in the clinical setting unless they're using that to Google work-related situations, so an illness that their patient has, a medication, or communicating with their lead instructor or their clinical liaison. Those types of distractors can also reduce their ability to think. There are some other factors that can also fog our thinking. These are just human habits that can present barriers to how we critically think. There's more than one way to get to a destination, but we have to remember principles whenever we start to change directions. Critical thinking requires us to learn and grow from our mistakes. So we have to also learn to feel comfortable saying things like, I don't know, or I'm not sure. So encourage your student to do that. If they don't know, they should tell you they don't know and be given an opportunity to find out the answer. Adapting a critical thinking model to nursing. I'm sure you remember from school Patricia Benner's novice to expert thinking. So critical thinking in nursing entails very results-oriented thinking. It is driven by the patient, the family, or the community needs. It's based on principles of the nursing practice, and it requires very specific knowledge, skills, and experience surrounding the situation that you're dealing with. So is critical thinking in nursing just good problem solving? We really have to have a broader view to succeed and a sincere desire to improve, to move from novice to expert. So ask questions like, what are my assumptions in this situation? Are my assumptions accurate? What additional information do I need? Is there a different way to look at this? What are some ways that practice has changed even since you have become a nurse? Think about those things as well. And ask your students these questions about the patients that they're caring for. Expert knowledge is gained from opportunities to be able to apply theory from the classroom into real situations. And in the nursing case, that means at the bedside. So that is really the main goal of this focused client care experience, is that they have ample opportunity to apply the theory that they've learned at the bedside and gain knowledge so that their critical thinking skills can improve. And you are going to be a huge help in their being able to reach that goal. So novice thinking, whenever we think about from novice to expert, students have very novice thinking. They organize their thought process as separate facts. They focus on action. So they focus on getting a task done, and they may forget to do something like assess. They need very clear-cut rules. They are very unaware of resources that are there for them because they don't have the knowledge that it is available. They may lack self-confidence and have increased anxiety. And like I said, very task-oriented. They're uncomfortable when a patient needs vary from what they are used to from a procedural steps. They may know the steps to a procedure, but what the patient needs may differ from that, and that will cause them anxiety. They won't know what to do. Limited knowledge means data collection, and that data collection is very superficial for a novice nurse. They tend to work and succeed by repetition in their memory. These students are going to learn best when they're matched with a very supportive and knowledgeable mentor that can help them move this thinking from novice on down the line towards expert. So expert thinking differs from novice thinking in the fact that it is organized and structured based on many experiences throughout your nursing career. You assess and you think before acting. You are aware of the resources that are there. You're self-confident, less anxious, more focused. You know what steps are safe to skip. You're very comfortable with rethinking when your client needs something different. Your data collection is much more in-depth and less superficial. And you can analyze and question the policies and procedures that are set forth for you and look for ways to improve them because of those experiences and that knowledge that you have gained with caring for patients. So expert thinking is very dependent on prior experience and this very elaborate conceptual knowledge that can be applied when you have a problematic situation. So talking through these situations that arise in the clinical setting with your student can help them understand how your expert thinking correlated to the situation versus their novice thinking. It's probably important to remember here also that the real expert is challenged by the novice's questions and not annoyed, because it gives them a chance to question and clarify their own thinking and help someone else. So let's talk about some strategies for helping develop clinical judgment, because this is really what we want for these students. We want them to critically think at the bedside and have good clinical judgment surrounding situations that might arise in their nursing career. That's what's going to make them a good nurse on the unit, and it's what's going to make them someone you would want to work with or take care of your family. So keep references available, learn normal values, and always ask these students why. Know problem-specific facts and how things will present in a different given set of circumstances. So if you have an adult patient with asthma, you can expand your students' thinking by saying, okay, but what if this was a child? How would it look different from a lab standpoint, from taking care of them at the bedside to medications? So help to expand their thinking in those ways, making sure that they have plenty of references available for situations. Teach your students to use the resources at their disposal. So policies that are online, medication information that's online, drug compatibility information online, anything that's a reference that they can use to better their care at the bedside. Make sure that they are applying the principles of the nursing process. They need to assess before acting, stay focused on the outcomes, and change approaches as needed to ensure that those outcomes are what are desired. Make judgments based on fact rather than emotional involvement, bias, or hearsay, and help them identify, if you identify that they might be making decisions based upon those things, help talk through those situations with the students. And make sure that they assist you with the plan of care for that patient or the computerized plan that you use. Develop a systematic approach to assessment. If your assessment is organized and systematic, it will help the students to better learn. Remember the novice thinking. Develop a system to evaluate urgency. So in other words, teach these students how to prioritize. So what can we do now and what can wait until later? Identify underlying causes for the problem. So what about a patient experiencing pain? If we are concerned with a medical problem, we might mask it with the intervention, such as pain medication. Try to identify underlying problems that might be causing the problem or a set of symptoms. So if you don't have a clue, don't be afraid to ask for help. Students really need to feel that from their mentor. Help those students identify priorities. Which patients should we see first? Which patients should we assess first? Which patient needs their meds first? Which one should we discharge first? And so on and so on. They learn through these situations. Help them also delegate, because that's also a big thing in the nursing world. So allow them to talk with the nurse aide about patient care, and encourage them to give a handoff report to the nurse aide, and not just NA to NA. Never perform an action if you don't know why it's indicated. This is a big one for students. If they don't know why they're doing it, they should not be doing it at all. Because if you don't know why or how something works, then you do not know whether or not there are risks involved in the current situation. That's something important for them to understand. There are a few things that our students cannot do in the clinical setting. They cannot access central lines. They cannot draw blood from central lines. They can only administer medications through a central line that is already established and is already running primary fluids. They cannot hang antibiotics on a line that's locked. So they can't do anything to access that line. They can only hang like a piggyback if there are primary lines already running. They are not allowed to administer any IV push cardiac meds, any blood products. They cannot verify blood or blood products. They cannot accept verbal orders. They cannot write orders, and they cannot enter orders into the electronic system because they are not licensed. They can perform any skill that cannot perform any skill that has not been checked off in the lab setting. So if they do not have it checked off on their passport in the lab setting here at school, they cannot do that in the clinical setting on a real person. These students cannot defibrillate either. A good rule of thumb is just to remember that they are not licensed, but they do carry their own malpractice insurance. Their passports are signed off and filed, and they definitely need practice with all of the skills that you were able to find for them. So, even simple ones such as vital signs, blood glucose, assessments, dressing changes, trach care, IV pushes and piggybacks, catheters, Foley care, ostomy care. And they may have done several of these on real people, and there may be one or two that they've never performed on a real person, but only in the lab. Just the key is that if they have not checked off in the lab, they cannot do it in the clinical setting. Always watch your students do an assessment because you want to know that what they're assessing is appropriate before you sign off behind them. Learn from your resources, and when in doubt, get help. Your students should really feel this. Your patients have the right to expedient care, and that takes precedence over the need for a novice to learn independently. So there may be situations where you have to take over the care, and that is fine. But please help the student after the situation is over and things are calmed down to understand what went on. So collaborate and then ask them questions like, what did you look for? How did you know what to look for? What was the biggest thing that you learned from this encounter? And have them clarify their knowledge and help reinforce their learning of situations like that. Help them become familiar with facility standards. So show them where the policies and procedures are located, and even for things that they cannot do, such as administering blood, you can still have them pull a policy and read over that, and assign them this type of work. Be familiar with the technology that you use. Most of our students are very good with technology and have been trained on the computer system that they'll be working with at your facility, and they've probably used that in clinical many times. May or may not be familiar with the IV pumps, so they may need a little in-service on that. They do not get to do a ton of IV things in clinical, so sometimes they do need help with those pieces of technology. So your IV pumps, your PCAs, that type of equipment. They probably will be very adept at the computer, but may need help with some of the bedside equipment. Always remember the importance of caring. So the care of the patient, the family, the community, each other, and yourself. Usually patients will describe this as going the extra mile. Your students are going to be watching this daily with your interactions with your patients, their families, other staff, the physicians, the other care providers, and they are very astute to what conversations happen at the desks, in the break rooms, in the med rooms, and they remember these experiences. So back to the beginning, make sure that how you are presenting things are how you want to be remembered by the student, because they do take all of these experiences to heart, and they carry these experiences with them. Follow the policy, but understand the reasoning. This is very important for the students as well. So again, remember, they have this novice thinking. They are very good at following step-by-step instructions, but the expert understands what steps can be safely skipped. So policies are there and procedures are there and designed to help us use good judgment as well as to protect the facility, but understanding the reasoning behind those policies and procedures are important. So help the students also to understand this. There are plenty of barriers to learning, as you see with your patients every day. And it's the same with students. So some of these barriers might include things like time, self-confidence. There may be situational barriers. There may be institutional barriers, such as new technology or new policies or procedures. And a big one is attitude. So be very clear with what your outcomes are for your student. So decide and agree upon what you expect. Let them know what they have to do to achieve the outcomes that you expect them to achieve. Think about daily goals. What do you want them to accomplish on the first day, on the second day, on the third day? And the student needs to be aware of these goals, because otherwise they can't meet them. So make some new goals every day at the beginning of the shift with your student, even if it's on a walk into the building. And then at the end of the day, evaluate, did we meet these or do we need work? And that can even be as simple as a conversation on the way to the car after you clock out. Clarify what they already know and determine what they need to learn. Ask them what their biggest concerns are. Be an active listener to those. Determine how they learn best. Are they a visual learner, an auditory learner? Do they have to be hands-on? And help to create an environment in which their learning style can be utilized to help them to the best of your ability. And encourage them to be very interactive and participatory with the care that you provide for the patients. Reduce anxiety by offering support. So remember that we all started somewhere. Help to minimize distractions and teach at appropriate times. Decide when it's appropriate to watch and when it's appropriate to do. So how much time should the student need to get this done? And what do you want them to learn from that? Talk about things beforehand and then have another conversation after. So if they're performing a skill, let's talk about what we need to do before we go into the room. Watch them do that skill. And then let's talk about how it went afterwards. That will help to reduce their anxiety, and they will know that you're there to support them. And that kind of brings us right into building confidence, constructive versus destructive criticism. A lot of how we can perform is closely related to self-esteem, and criticism can bring up some really intense and uneasy feelings for all of us. And it can cloud our ability to be objective as well. So are we good enough? Am I ever going to get this? So discuss these emotional responses to criticism with your student and let them know that you're giving them constructive criticism, and it doesn't mean that you think they're not smart or that they're not going to be a good nurse. Sometimes they have to hear you say that. Strategies for giving feedback. Be sensitive to personality differences. Some people accept criticism very well, and you can be very blunt about it, and others may not. Maintain a mutual trust between them. Give frequently feedback to them, and keep the positive and the negative separate. So start with what's going right. These are the things you're doing well. Catch them doing something right and tell them that. And remain very focused while presenting information and feedback, particularly when it's negative. And set goals for each day, like we've talked about. So today, for example, you're going to care for 3 patients. We need to improve time management. I want you to have your 3 assessments completed and documented in the computer by 8:30. I want you to be prepared to give your medications by 9 and meet me at 8:45. So sometimes that feedback needs to be very succinct. Evaluate every day. Like I said, even if it's done in the parking lot on the way to the car, and ask the student if they could do this day over, what would they do differently? Accepting feedback and being able to accept that feedback is really important, because this is how our students can improve. So pay attention to their emotions. We don't want anyone taking everything personally. The students will also be evaluating you. So if you are upset, you can't be objective, and use that feedback in a positive manner. Make sure that the students are not making excuses, because whenever we make excuses, we're being defensive. Monitoring our own behavior and the behavior of students, and paying attention to how we respond to each other can help us improve accepting feedback. None of us are perfect. So, putting the pieces together, you will receive a mentor's packet, and the students will also have a packet that they will bring with them to the clinical site. We have here at Southeastern Community College some important expectations for our students. They are to exhibit professionalism at all times, in front of the patients, in front of staff, etc. They have to be respectful and civil at all times and to all individuals. They must be punctual and timely for their shift and their returns from breaks or lunch. They need to be prepared for their shift. They need to be prepared for situations that arise. And they must follow the dress code at all times. Their uniform is an SCC issued scrub, navy blue scrubs, with an SCC patch on the sleeve. And if they wear a lab coat, it must be white, and it has to have the SCC patch on the sleeve. They must wear white shoes and socks that are in clean repair. Any undershirts that they wear must also be white. They are not allowed to wear jewelry of any kind. Tattoos have to be covered at all times. And they cannot wear false eyelashes. We also expect that they keep their hair pulled back and away from their face so that it does not cause any infection control issues when caring for patients. If you have questions or concerns about your student, you can always reach out to the hospital liaison or to the liaison who is following that student. That person will contact you and introduce themselves. You can reach out to the lead instructor for the course that they are taking at the time. We are always available, particularly the liaison for the student. The student will have the liaison number, and you can reach out to that liaison day or night, no matter the time. Thank you again so much for participating in being a mentor for Southeastern Community College. We are very grateful that you have volunteered to help us mold and shape the next generation of fabulous nursing professionals that will take care of our community. We are very grateful for you. Thank you, and thank you for listening to this presentation.